Hello everybody, Kemo Sabi here, coming at you with another video. This one's off a cdc.gov webpage with the National Center for Health Statistics. With the topic of weekly updates by select demographic and geographic characteristics. Provisional death counts for coronavirus disease 2019 COVID-19. Contents. This was also updated September 30th of 2020. Daily updates of totals by week in state, excess deaths associated with COVID-19, weekly updates by select demographic and geographic characteristics, index of available data files, technical notes, health disparities, race, and Hispanic origin. Note, provisional death counts are based on death certificate data received and coded by the National Center for Health Statistics as of September 30th, 2020. Death counts are delayed and may differ from other published sources, see technical notes. Counts will be updated every Wednesday by 5 p.m. Additional information will be added to this site as available. List of topics. Number 1, age and sex. 2, race and Hispanic origin. 3, place of death. 4, camaraderies. 5, excess deaths. 6, state and country data files. For the index of provisional COVID-19 mortality surveillance and ad hoc data files, there's a lot of click here places. We're just going to read this page and not click further. Age and sex. Table 1 has counts of death involving COVID-19 and select causes of death by sex and age group for the United States for data on sex and age at the state level. Click here. For data on sex and age by week. Click here. Notice to users. The data file for deaths by sex and age at the state level have been updated on September 2nd, 2020 to include the following age groups in addition to the age groups that are routinely included: 0 to 17, 18 to 19, 30 to 49, and 50 to 64. The new age groups are consistent with categories used across CDC COVID-19 surveillance pages. When analyzing the file, the user should make sure to select only the desired age groups. Summing across all age categories provided will result in double counting deaths for certain age groups. Data on deaths involving COVID-19 among ages to 0 to 18 are available here. And then we have tables, and we're going to go over them. So, Table 1, deaths involving coronavirus disease 2019 COVID-19, pneumonia and influenza reported to NCHS by sex and age group, United States, week ending in 2/1/2020 to 9/26/2020, updated on the 30th of September 2020. Okay. So, first, we're going to have a broad table which has all ages at the top, and then we'll have from underneath that under 1 year, 1 to 4 years, 5 to 14, 15 to 24, 25 to 34, 35 to 44, 45 to 54, 55 to 64, 65 to 74, 75 to 84, and 85 years and over. So the first is the age group. The first, that'll tell you the age. So then the next and the first big number that I'm going to give you is all deaths involving COVID-19, which we're calling UO7.1. The next number is deaths from all causes. The next number is deaths involving pneumonia with or without COVID-19, excluding influenza death, which is called J12.0 or J18.9. The next number will be deaths involving COVID-19 and pneumonia, excluding influenza, which is called UO7.1 and J12.0 and J19.9. And then the next number is all deaths involving influenza with or without COVID-19 or pneumonia, J09 and J11. The next number is deaths involving pneumonia, influenza, or COVID-19, UO7.1 or J09 or J18.9. And then the last number is out of the whole entire population of that specific age group, and the numbers broken down that you're getting first. So here we have it. We'll do the first table, then the next table is males, next table after that is females, and then they're going to have a Hispanic table as well. And we'll just go down the whole page and we'll see what this is all about. So, all ages, so that's the age group, and then all deaths involving COVID-19, and then from then on, as I said. So, 194,091 to 2,087,504. to 197,973 to 87,714 to 6,705 to 310,055, and then the population number, out of 327,167,434. Under 1 year, 20 to 11,719 to 105 to 3 to 16 to 138 to 3,848,208. Ages 1 to 4, 15 to 2,233 to 75 to 2 to 42 to 130 to 15,962,067. Ages 5 to 14, 32 to 3,476 to 106 to 8 to 52 to 182, out of 41,075,169. Ages 15 to 24, 362 to 23,385 to 455 to 131 to 53 to 735, out of 42,970,800. Ages 25 to 34 years old, 1,513 to 46,033 to 1,664 to 673 to 151 to 2,641, out of 45,697,774. Ages 35 to 44 years old, 3,956 to 65,059 to 3,748 to 1,751 to 250 to 6,173, out of 41,277,888. Ages 45 to 54, 10,389 to 119,436 to 9,754 to 4,871 to 577 to 15,744, out of 41,631,699. Ages 55 to 64 years old, 24,772 to 270,191 to 26,025 to 12,079 to 1,240 to 39,739, out of 42,272,636. Ages 65 to 74 years old, 41,866 to 413,865 to 44,018 to 20,292 to 1,457 to 66,808, out of 30,492,316. 75 to 84 years old, 51,365 to 504,433 to 54,045 to 23,954 to 1,480 to 82,728, out of 15,394,374. 85 years and over, 59,801 to 625,674 to 57,978 to 23,950 to 1,387 to 95,037, out of 6,544,503. Then we have the males table. So the first is all ages and under 1, 1 to 4, 5 to 14, 15 to 24, 25 to 34, 35 to 44, 45 to 54, 55 to 64, 65 to 74, 75 to 84, and 85 years and over, as is going to be the exact same for the females table. And as we're going, the first number is all deaths involving COVID-19. The next one is deaths from all causes. Next one is deaths involving pneumonia with or without COVID-19, excluding influenza deaths. The next number is deaths involving COVID-19 and pneumonia, excluding influenza. The next number is all deaths involving influenza with or without COVID-19 or pneumonia. And the next number is death involving pneumonia, influenza, or COVID-19. And the last number is out of the population. So, males. All ages, 104,896 to 1,089,340 to 108,473 to 49,465 to 3,455 to 166,745, out of 161,128,679. Under 1 year, 13 to 6,487 to 65 to 2 to 8 to 84, out of 1,968,505. Ages 1 to 4. 7 to 1,305 to 37 to 1 to 25 to 68, out of 8,162,697. Ages 5 to 14. 22 to 2,062 to 54 to 7 to 23 to 92 out of 20,974,830. Ages 15 to 24. 223 to 16,595 to 283 to 82 to 27 to 448 out of 21,976,455. Ages 25 to 34, 1,003 to 32,519 to 1,033 to 435 to 76 to 1,668 out of 23,210,709. Ages 35 to 44 years, 2,698 to 42,918 to 2,283 to 1,199 to 133 to 3,992 to 20,587,600. Ages 45 to 54 years, 7,063 to 75,065 to 6,101 to 3,323 to 342 to 10,111 to out of 20,541,202. Ages 55 to 64, 16,067 to 168,282 to 15,868 to 7,779 to 705 to 24,702 out of 20,398,863. Ages 65 to 74, 25,722 to 240,467 to 26,462 to 12,554 to 813 to 40,288 out of 14,246,085. 75 to 84 years old, 28,239 to 262,137 to 30,261 to 13,530 to 737 to 45,589 out of 6,735,040. Ages 85 years and over, 23,839 to 241,503 to 25,936 to 10,553 to 566 to 39,703 out of 2,325,693. Females, all ages, 89,191 to 998,082, 89,493 to 38,245 to 3,249 to 143,302 out of 166,038,755. Under 1 year, 7 to 5,212 to 40 to 1 to 8 to 54 out of 1,879,703. Ages 1 to 4, 8 to 912 to 38 to 1 to 17 to 62 out of 7,798,370. Ages 5 to 14, 10 to 1,414 to 52 to 1 to 29 to 90 out of 20,100,339. Ages 15 to 24, 139 to 5,789 to 172 to 49 to 26 to 287 out of 20,994,345. Ages 25 to 34, 510 to 13,512 to 631 to 238 to 75 to 973 out of 22,487,065. Ages 35 to 44, 1,258 to 22,136 to 1,365 to 552 to 117 to 2,181 out of 20,690,288. 45 years to 54, 3,325 to 44,368 to 3,652 to 1,547 to 235 to 5,632 out of 21,090,497. 55 to 64 years, 8,705 to 104,901 to 10,166 to 4,300 to 534 to 15,035 out of 21,872,773. Ages 65 to 74 years, 16,143 to 172,389 to 17,555 to 7,737 to 644 to 26,519 out of 16,246,231. 75 to 84 years, 23,125 to 242,282 to 23,782 to 10,423 to 743 to 37,137 out of 8,659,334. 85 years and over, 35,961 to 384,151 to 32,040 to 13,396 to 821 to 55,332 out of 4,218,810. Note: number of deaths reported in this table are the total number of deaths received and coded as of the date of analysis and do not represent all deaths that occurred in that period. Counts of death occurring before or after the reporting period are not included in the table. Data during this period are incomplete because of the lag in time between when the death occurred and when the death certificate is completed. Submitted to NCHS and processed for reporting purposes. This delay can range from 1 week to 8 weeks or more depending on the jurisdiction and cause of death. 1. Deaths with confirmed or presumed COVID-19 coded to ICD bracket 10, code UO 7.1. 2. Counts of death involving pneumonia include pneumonia deaths that also involve COVID-19 and exclude pneumonia deaths involving influenza. 3. Counts of death involving influenza include deaths with pneumonia or COVID-19 also listed as a cause of death. 4. Deaths with confirmed or presumed COVID-19, pneumonia, and influenza coded to ICD bracket 10, codes UO 7.1 or JO9 bracket 18.9. And 5. Population is based on 2018 post-census estimates from the U.S. Census Bureau. And then there's a little bit of like a graphing here, saying provisional death counts for coronavirus disease 2019 COVID-19 by week of death. Data represented with a dashed line or incomplete deaths counted will be updated as additional data is received. And it goes from, and there's also a note here, and then I'll just show you what it looks like. Provisional death counts are based on death certificate data received and coded by the NCHS as of the date of analysis and do not represent all deaths that occurred in that period. Data for the most recent 5 weeks, shown with dashed line, are typically less than 90% complete. With low levels of completeness in more recent weeks, death counts are updated as additional deaths are received and coded. Source: NCHS. National Vital Statistics System estimates are based on provisional data. Okay, I hope you can see that. So we have this graph here. It's showing the dates on the bottom, and it goes up. And then we have all numbers here. We'll just give you a brief look. So it's just telling you, so all ages, COVID-19 deaths, total deaths, and by specific months and dates here. And we'll leave the site link so all of you can actually go to this page and take a look yourself. So we'll just go over everything because it's so many numbers to go through. So we'll continue here, whatever's left there. So, race and Hispanic origin. Data by race and Hispanic origin are available at the national, state, and country level. Data by race and Hispanic origin is also available by age at the national and state level. Click here to visit the NCHS Health Disparities Race and Hispanic Origin page. Place of death. Table 2 presents death counts of COVID-19 and other select causes of death by the place of death. For data on the place of death at the state level, click here. For data on the place of death by age group, state, and NCHS region, click here. Table 2. Deaths involving coronavirus disease 2019, COVID-19, pneumonia, and influenza reported to NCHS by place of death, United States, week ending in 2/1/2020 to 9/26/2020. Updated September 30th, 2020. So we have the place of death, which is going to be the total, then healthcare setting inpatient, then healthcare setting outpatients or emergency room, then healthcare setting dead on arrival, then the next descendant's home, the next hospice facility, the next nursing home / long-term care facility, other, and place of death unknown. Then the first number will be all deaths involving COVID-19, which is UO 7.1. The next number will be deaths from all causes. The next number will be deaths involving pneumonia with or without COVID-19, excluding influenza deaths, which is J12.0 bracket J19.9. The next number will be deaths involving COVID-19 and pneumonia excluding influenza, UO 7.1 and J12.0 bracket J19.9. And the last number is all deaths involving influenza with or without COVID-19 or pneumonia, J09 bracket J11. So, the first one, total, 194,091 to 2,087,504 to 197,973 to 87,714 to 6,705. And the next one, 126,357 to 610,157 to 141,425 to 69,910 to 4,062. The next one, which is healthcare setting, outpatients or emergency room, and then from on there, as I said in the beginning, 6,819 to 123,902 to 6,509 to 2,239 to 242. Next one, 185 to 5,983 to 138 to 45 to 11. The next one, 10,456 to 706,014 to 13,467 to 2,162 to 1,445. The next one, 5,758 to 130,766 to 9,459 to 2,648 to 317. The next one, 41,089 to 366,483 to 23,687 to 9,788 to 529. The next one, 3,358 to 140,170 to 3,227 to 897 to 99, and the last one, 69 to 2,029 to 61 to 25 to 0. Note: number of deaths reported in this table are the total number of deaths received and coded as of the date of analysis and do not represent all deaths that occurred in that period. Counts of deaths occurring before or after the reporting period are not included in the table. Data during this period are incomplete because the lag in time between when the death occurred and when the death certificate is completed, submitted to NCHS, and processed for reporting purposes. The delay can range from 1 to 8 weeks or more depending on the jurisdiction and the cause of death. 1. Deaths was confirmed to pursuing COVID-19, coded to ICD bracket 10, code US 7.1. 2. Counts of death involving pneumonia include pneumonia deaths that also involve COVID-19 and exclude pneumonia deaths involving influenza. And 3. Counts of death involving influenza include deaths with pneumonia or COVID-19, also listed as a cause of death. Camaraderies. Table 3 shows the type of health conditions and contributing causes mentioned in conjunction with deaths involving coronavirus disease 2019, COVID-19. For 6% of the deaths, COVID-19 was the only cause mentioned. For deaths with conditions or causes in addition to COVID-19, on average, there was 2.6 additional conditions or causes per death. The number of deaths with each condition or cause is shown for all deaths and by age group. For data on camaraderie, click here. So, Table 3. Conditions contributing to deaths involving coronavirus disease 2019 by age group, United States, week ending in 2/1/2020 to 9/26/2020. Updated September 30th of 2020. Okay, so this is a larger table here. So the first one is conditions contributing to deaths where COVID-19 was listed on the death certificate. So we're going to have the first one, which will be total COVID-19 deaths as of 9/26/2020. And then after and under that, it'll be respiratory diseases, which is influenza and pneumonia, chronic lower respiratory diseases, adult respiratory distress syndrome, respiratory failure, respiratory arrests, other diseases of the respiratory system. Then it's circulatory diseases, hypertensive diseases, asthmatic heart disease, cardiac arrest, cardiac arrhythmia, heart failure, cardiovascular disease, other diseases of the circulatory system, sepsis, malignant neoplasms, diabetes, obesity, Alzheimer's disease, vascular and unspecified dementia, renal failure, intentional and unintentional injury, poisoning, and other adverse events. All their conditions and causes residual. So, total COVID-19 deaths. So, and we have the codes, ICD bracket 10 code, so UO 771. So all ages for the total COVID-19, which is the first one, and then we're doing respiratory diseases, as we listed, circulatory diseases, to sepsis, malignant neoplasm, diabetes, obesity, Alzheimer's disease, vascular and unspecified dementia, renal failure, unintentional injury, and poisoning and other adverse events, and all the conditions and causes. So, all ages, 191,211, 0 to 24 years, 426, and then the next one, 25 to 34 years, 1,487, 35 to 44, 3,867, 45 to 54 years, 10,221, 55 to 64 years, 24,387, the next one, 65 to 74 years, 41,206, 75 to 84, 50,585, and the last one, 85 years and over, 59,026. So the first number is all ages, and it goes from 0 to 24, 25 to 34, 35 to 44, 45 to 54, 55 to 64, 65 to 74, 75 to 84, and 85 years and over. So now the next one will be respiratory diseases. Influenza and pneumonia, which is coded as J09 bracket J18. The first number, 82,417 to 150 to 682 to 1,751 to 4,883 to 11,684 to 18,954 to 21,949 to 22,362. Chronic lower respiratory diseases, coded as J40 bracket J47. First number, 16,530 to 31 to 73 to 165 to 471 to 1,773 to 3,978 to 5,244 to 4,794. Adult respiratory distress syndrome, coded as J80. First number, 25,150 to 73 to 278 to 725 to 2,095 to 4,467 to 6,649 to 6,090 to 4,771. Respiratory failure, coded as J96. First number, 66,156 to 130 to 481 to 1,248 to 3,705 to 8,892 to 15,471 to 18,234 to 17,993. Respiratory arrest, coded as R09.2. First number, 3,896 to 9 to 30 to 77 to 186 to 441 to 803 to 1,027 to 1,223. Next one. Other diseases of the respiratory system, coded as J00 bracket J06, J20 bracket J39, J60 bracket J70, J81 bracket J86, J90 bracket J95, J97 bracket J99, and U04. First number, 6,995 to 25 to 61 to 150 to 371 to 913 to 1,506 to 1,869 to 2,060. And then we have circulatory diseases. Hypertensive diseases, coded as I10 bracket I15. First number, 41,893 to 19 to 123 to 549 to 1,822 to 5,088 to 9,256 to 11,540 to 13,496. Asthmatic heart disease, coded as I20 bracket I25. First number, 21,739 to 2 to 30 to 115 to 523 to 1,998 to 4,503 to 6,608 to 7,559. Cardiac arrest, coded as I46. First number, 22,592 to 60 to 225 to 561 to 1,568 to 3,466 to 5,385 to 5,902 to 6,425. Cardiac arrhythmia, coded as I44, I45, I47 bracket I49. First number, 12,086 to 11 to 28 to 74 to 282 to 898 to 2,202 to 3,588 to 5,003. Heart failure, coded as I50. First number, 12,671 to 6 to 45 to 99 to 336 to 1,088 to 2,197 to 3,526 to 5,374. Cardiovascular diseases, coded as I60 or I60 bracket I69. First number, 9,277 to 7 to 28 to 97 to 346 to 1,077 to 2,128 to 2,723 to 2,000. 970. Okay. Next one is other diseases of the circulatory system, coded as I00 bracket I09, I26 bracket 140, I43, I51, I52, I70 bracket I99. First number 10,764 to 51 to 116 to 253 to 610 to 1,422 to 2,419 to 2,670.